Okay, good morning, good afternoon, and good evening, and welcome to all of you to this session on fighting COVID together. My name is Lars Stordal, and I'm the program officer at the GWOP Secretariat at UN Habitat, and I'm sending you greetings from the UN campus in Bonn. And in this session, before we start, I will just like to mention a couple of technical aspects. We do have a participants chat on the right-hand side, and if you're joining the chat for the first time, you will be required to sign in. We encourage that you sign in using your social media account or your email so that we can see and pick up your name for questions and discussion during the session. We also offer simultaneous interpretation into French, English, and Spanish, and you can change your language through the live translation buttons on the right-hand side of your screen. Just to note that if you choose to listen to the session in one of the other offered languages, you should please lower the volume on your main screen. Lastly, of course, we are very grateful to all the speakers and participants to make this event possible, and for their support to WOPS and GWOPA today at the Congress and beyond. Without any further ado, I'm now handing over the floor to the moderator of this session, who is Mr. Peter Macy, co-founder and president of Rock Blue. We are co-convening this session with the Rock Blue Foundation and the Bonn Water Network. Peter, over to you. Thank you.
Thank you, Lars. And I also am just very pleased to have all these panelists today to be talking on some very important issues, and I'm looking forward to a lively discussion. What I'm going to do is I'm going to give each panelist the opportunity to answer a question that I formulated ahead of time and to get them to respond in under 10 minutes. All the panelists know to keep any responses to less than 10 minutes. And then if there's any time left over, there could be other dialogue with other panelists or even in the responding to any of the chats for those who are attending this particular webinar. So let's jump right in. Jonathan Campada, I'm going to start with you. So Jonathan is the MD of Lusaka Water Supply and Sanitation in Lusaka, Zambia. They serve about 3 million people, and they've, like everyone else, have had their challenges with the pandemic and how to respond to it. So Jonathan, the question I have for you, and you'll have to unmute yourself for the response, is how did Lusaka Water Supply and Sanitation, how did they manage the COVID supply chain disruptions? Because I know that you had supply chain disruptions. How did you manage that effectively, and were there any lessons learned from that? Go ahead, Jonathan, over to you.
Thank you, Peter, and greetings to everyone who's on this session. Indeed, as you put it rightly, just like any other utility, we're affected by the COVID-19 pandemic. Specifically on the supply chain aspects, you have to understand that we have some projects which we are implementing. This is to do with improving both water and supply, and we have our daily operations as well in terms of the inputs we use for our business, and this is mostly on the operational side. For instance, the water treatment chemicals, as well as some of the major equipment, especially pumps, which are imported. So we actually did see that when the COVID-19 did hit in March of 2020, it was declared in Zambia as a pandemic, as well as in Southern Africa region. And our immediate impact was from the materials we get from South Africa. And we get mostly the water treatment chemicals from our neighbors in South Africa. And due to the shutdowns which were instituted in that country, obviously the factories, for instance, were not operating at full capacity, but then also the borders were affected. So we saw that even if we had paid for these supplies to come in, they were not able to come in time, and our stocks were actually running down quite fast. Zambia, being a country that also gets a lot of goods from South Africa, I think the government moved in very fast. I think to discuss with the South African government that at least they can allow critical goods to be able to be shipped. And water treatment chemicals were one of them. But despite that, the truck drivers, for instance, they had to be in quarantine before they at the border points before they can deliver the goods. So despite even us knowing that our goods are in transit, they were also stuck on the border. So again, the partnerships with our local utility companies came in key, because now it meant that just at the stroke of a phone call, we were able to find out which other utilities had some chemicals in stock. And luckily enough, I think this happened. So we managed to get some chemicals from our sister company, which is Nkana Water, for which we are very grateful for that support. So we were able to get some chemicals to keep us going while our shipment came. Then we were able to give them back. So the lesson learned there is obviously partnership. You should be in good relationship with your peers. So it's easy to pick up a call, and assistance is given at a short time. In terms of pumping equipment, we did have some projects which we had actually completed and ordered some borehole pump, which is specifically made for type of high-yielding borehole pump, and this is coming all the way from Denmark. Now the supply chain challenges in Europe again caused the problem. We could not get that pump in good time, and with the COVID-19, demand for water is key, and our customers in that area were looking forward to get this supply. But we just had to find an alternative in terms of a local pump which is available, but obviously of a lower duty. So we're not able to deliver the quantity of water we initially planned for, but that helped us at least to provide water to that community while the pump we're waiting for could actually come. In this aspect, I think it's difficult for us to keep a backup, because this is a pump which is made specifically for that type of condition, and even the manufacturers don't have it off the shelf. So again, the lesson maybe is you should always have maybe some backup, even if it's not 100% okay, but something that will keep you going now. You are looking for the ideal situation. We had a major project which we are running, which is a Kafue bulk project, whereby we are bringing in additional 50,000 cubic meters of water into Lusaka, and we're working on the power substations. We require 4 times 10 MVA transformers. So these transformers are imported, and the equipment also, the switch gears and everything from China and India. Despite us having had the equipment ready for shipment in March of this year, the equipment was ready in March this year, but we could not have it shipped. I think India was also hit hard by the COVID-19. In China, issues of the congestions in the ports was an issue. Part of the requirement for shipping the equipment is to have pre-shipment inspection and testing. And we have our experts from our electricity company who were supposed to go and certify the equipment. This was not possible. So we had to think, what can we do? So we had to use the international certification agencies. I think in this case, we managed to use the SSGS. They got their local experts to go and do the certification. So that was done. Now the problem again was with the shipping of the equipment. In India, we even had a situation whereby we were told the container is at the port, but the port is closed. And you've got all sorts of stakeholders here who want the project to be done, and you're explaining that you can't ship because of COVID. So all sorts of ideas came in. Can we do the air freight? We looked at the costs, and it was quite, not only the cost, but also the bulkiness of the equipment. It had to come by sea freight. So we had to involve our Ministry of Water, our Ministry of Foreign Affairs, who engaged the embassies in India and China to see what intervention they can come up with. Unfortunately, they managed to even intervene up to the level of the shipping company. But this equipment is very important. So basically, we had to jump the queue, and the equipment which we're expecting in March only arrived in September. So you can imagine the delay which was there. Meanwhile, there's a lot of demand for water in the city of Lusaka, and COVID is one of the need for water to fight COVID and the pressure on us to deliver that project. So at least we managed to get that equipment in by September, and right now everything has been assembled. We hope by the end of this month we'll be able to do the test run and supply the much needed water to the citizens in Osaka. So again, a lesson learned there is the use of various networks. You can't do it alone. So make use of the government contacts, in this case through our ministries and the embassies. So they were able to actually help us ensure that they influence the quick shipment of the much needed equipment. So basically, I think those are the key issues which we faced during the COVID pandemic. Thank you.
Jonathan, thank you for a very, very comprehensive, detailed explanation of what you all went through to survive the pandemic. And again, you had the responsibility of about 3 million customers, which is a huge responsibility. But you and your team fought back and kept the taps running. I applaud your efforts. Before we go into the next speaker, are there any of the panelists who want to add on or comment or question? Jonathan? All right, let's go into our next panelist, Valentine Kalpa. He's the corporate planning manager at Lilongwe Water Board. Valentine, if you would, just unmute your microphone. There you go. And I've got a question for you, Valentine, and that is, if everyone else could turn off their microphones, that'd be great. Okay, Valentine, the question for you is, what impact did the pandemic have on Lilongwe Water Board's non-revenue water, and how did you plan to mitigate those impacts? Valentine, if you can turn on your camera again. So it's a big issue. All water utilities have got this issue of non-revenue water. It's a big deal. And what impact did the pandemic have on you, and how did you sort that out with regards to non-revenue water? Go ahead, Valentine.
All right. Thank you very much, Peter. Yes, indeed. During the COVID pandemic, we had a number of impacts in as far as non-revenue water reduction is concerned. Broadly, I'll start with the broad impacts that the COVID-19 pandemic had on our operations. So basically, the impacts of the COVID-19 pandemic could be grouped into three. The first one is the interruption to labor force, that is the staff of Lilongwe Water Board. The second one was the disruption to supply chains, which Jonathan has just elaborated. The third one was the pressure that we had on our finances, the financial constraints that resulted from the COVID. So all these effects had a combined effect on our non-revenue water reduction activities. Non-revenue water cuts across all those areas that I've mentioned. So to begin with the labor aspect, we had to go into in the early stages of the COVID-19 pandemic, we went into a sort of a shutdown or a lockdown. The city went into a lockdown. So we were operating with a lean structure with very few staff. So that affected our ability to respond quickly to faults in the field, because we were now using less staff, less than optimum members of staff. So that affected our response to faults. It also affected our like the turnover period to respond to faults. Ordinarily, we want to respond to any fault within 2 hours of being reported. But with the reduced staff, we were not able to do that. So the turnover period slightly went up. So we could have some faults that could not have been attended in the 2 hours, the prescribed 2 hours, but rather in some went as much as a day without being repaired. So that, as you can see, contributed to the non-revenue water, quite significant, in fact. The second one under the labor constraints is that we have a huge challenge in the city with illegal connections. On average, every month when we're conducting the inspections, house-to-house verifications, it's a program that we do every month. We unearth about not less than 20 illegal connections. Now, during the COVID, because we had lean staff, we suspended these programs for customer verifications. Now that resulted in increased non-revenue water. Again, the suspension of the house-to-house verifications was also a result of some customers would refuse us to get into their premises. They would say, do you have a COVID negative certificate? Have you been tested? So it became hard. You know how COVID came into when it just came up, there was a lot of misinformation. There was a lot of panic and fear. So some customers took that as an advantage to say, we will not allow what about staff to access the premises. So as you can see, that also contributed to high non-revenue water, especially on the commercial losses aspect. Again, related to that, Jonathan did mention that water demand during COVID-19 pandemic peaked. It is the same with us. So when we had, at the peak of the COVID-19 pandemic, the demand for water was very high because everybody needed to wash their hands regularly, and there was also pressure on us to extend water connections to some areas that were not serviced prior, or they were being serviced by, let's say, water bowsers. The need to give them piped water was now amplified. So as a result, we are increasing a pipe length, pipe network. That means the leakage per kilometer of pipe network also increased. So that's another area that resulted in, that's one area where we can say COVID really impacted our non-revenue water. On the supply chain constraints, I'll not dwell much on that because much has been explained by Jonathan. The situation was quite similar to us. Now, of course, for us, specifically to non-revenue water, we had to suspend some capital projects. For example, our planned pipe replacements, we suspended pipe replacements. We've been replacing asbestos cement pipes with PVC or HDPE pipes. So we had to suspend that, one, because we could not ship in time the pipes from South Africa, which is our main, where we import much of our materials. And again, due to the financial constraints, we had a reduced capex. So some of those programs, those capital programs like pipe replacement were suspended because our cash position was quite weak. The COVID-19 pandemic, like I said, the third impact was on the financial constraints. We had a significant reduction in revenue collection, about 53% due to the pandemic. And we had to suspend disconnections, which is for us, if we want to increase revenue collection, if we want to reduce arrears, the first and easiest strategy is to enhance disconnections. But at that time, there was a public outcry to say, well, water is essential in the fight against COVID. So why are you disconnecting people due to non-payment of water bills when they need water every day to fight the pandemic? So we scaled down significantly on disconnections. As a result, our revenue collection also dropped, as I indicated, to about 53%. So due to that, we had to suspend other programs, particularly the capital projects. The CAPEX was suspended, and that resulted in an increased non-revenue water. At that time, just before the pandemic, our non-revenue water was at about 31%, rather 39%. But at the peak of the pandemic, it was about 41.7%, 41%, close to 42%. So as you can see, we attribute that rather a huge jump within a year to the COVID-19 pandemic. Going forward, what we are planning to do is, first of all, what we've learned and what we did was strategic collaboration is quite important. During the pandemic, we had a lot of support from Rock Blue. They assisted us with the financial assessment tools. That's the tool that we use to identify where exactly we had been hit the hardest in terms of financial, in terms of our finances. And again, we were able to plan to prioritize what kind of works need to be prioritized given the circumstances. So that's one lesson that we take, and also that's one of the activities that we did to ensure that we cushion the effects of the COVID-19 pandemic on our operations, strategic collaboration. The second one, now we are planning to leverage on technology. We've decided to increase, or at least put a little bit more effort in installing prepaid meters. Again, we want to utilize the SCADA system to ensure that we reduce the human interaction between ourselves and our customers for in our operations. So we've already started implementing these programs. We are just about to implement a SCADA system for monitoring of the pipe network, the water distribution, treatment and distribution as well. And we're installing our prepaid meters, as I've said. We're just scaling up. We had already started, but now we're scaling up because the impact that the pandemic had on staff was just it was just unprecedented. There was a time we had about less than 35% of staff available, not because others are working from home, but there was an outbreak within Lilongwe Water Board. And at that time, most people were isolating, others were hospitalized, and the impact was just huge. So that has forced us now to take advantage of the available technologies that we have to ensure that we implement various technologies in our system. Thank you very much, Peter. Over to you.
Valentine, thank you very much. Yeah, this is a topic of great concern, and you're not alone in having that pressure put on your non-revenue water due to the pandemic. I heard that from many other utilities. Let me open it up to see if there's anyone who has any questions from the panel for Valentine. And if not, we'll move to the next panelist. All right, Valentine, thank you very much. Margaret Maina, if you wouldn't mind turning on your camera and also your microphone. So our next panelist is Margaret Maina. She is the managing director for Limuru Water. And Margaret, you've got 10 minutes, and I've got a very important question for you. And this follows on what Valentine said about workforce disruptions. And I'm sure that you had many. Can you talk about your workforce disruption by those that were quarantined, those that were sick, those that were working remotely, and how did you and your workforce adapt to the disruptions that you had and perhaps still have today because of the pandemic?
Thank you so much, Peter. Yes, I'm Margaret Maina, Managing Director for Rimuru Water and Sewerage Company. Rimuru Water is in Kiambu County, which is neighboring Nairobi Metropolitan. So we always say that we are in the bedroom of Nairobi. As with the other organizations, we are also affected by COVID-19. The first outbreak was reported in Kenya in March. And as the other utilities have said, it was a fearful moment for all members of staff from the water utility because of the fear of unknown. First, when by the time it got to Nairobi, we had heard what had happened in the other countries, and there was that panic that what will happen if it happens to Africa, where we don't have that such much resources. So for us, it was also a hectic moment for us because there was also issue of water provision, which was a challenge, and the greatest challenge was the locking down of Nairobi Metropolitan. Our company serves an area in Nairobi Metropolis and another area within the rural part. And when there was a shutdown of Nairobi, the population people could not get in and out of Nairobi from the other counties. And it so happened that two of the major barriers where they had blocked the roads within our area, Rimuru. So people could not pass the main highways to Busia, Kisumu. And our water utility has offices within the metropolitan area and within the rural area. So it was also a very big issue for our staff to move across those barriers. And it caused some panic because of the fear of contracting the COVID-19. At that time, there were no known PPEs. Masks were not there even in our shops because they were used for medical purposes. And then when the Minister of Health brought out the protocols to be taken, that wearing of safety gear, keeping distance, it was very difficult for people working in the water companies because water was supposed to be provided, and it is also an essential service. So getting masks first was an issue because the country had to import from China and other countries, and also the various items like the sanitizers were also not available. We also had to put hand washing facilities in the public areas, including the hospitals and our offices, and provide the same for the public, even in the bus parks, so that to avoid the infection and the spreading of the pandemic. So that one was the first challenge, preventive, because of lack of PPEs. And the ones which came first, they were given to the medical fraternity, which were the first line workers. And eventually, after the lockdowns, the airports were closed. Our country, our areas, people started in the industries producing the PPEs, and we saw the influx of masks. And also the industries, our local industries also started producing our sanitizers and soaps, which we were able to access. And we got a lot of donations through our major stakeholders and our partners, and especially the development partners, who also aided the water companies with the provision of water treatment chemicals and the sanitizers and the soaps for the members of staff. So that was the first line where we started. And then there was also as we progressed to the month of May, where there was a peak. Isolation of our members of staff, also limiting the movement to offices, especially the customer care. We had to restrict the people who were coming to our offices for so that we could not pass over the the majority of the staff have to go at the few O&M issues, and also meter reading. We're also doing physical meter reading to our customers. And as my brother has said, we were not able even to get to the customer premises because they were fearing that we might pass the infection onto them. So first, what we did now to mitigate that, we had to work in shifts in some areas, and the people in the field, we were also to go into shifts, and also we reduced the number so that at least to keep the social distance as required. To give the staff the comfort, we formed a committee, a working committee for the staff, and which was members of staff from each department. And one of the issues was to make sure that the Minister of Health protocols were observed, so that even the staff who are working in the field, they were properly supervised so that they were not to get infected. And then after doing that, we provided the PPEs, and this committee was to make sure that the staff were wearing the masks and the PPEs were on duty. And we also provide the sanitizers in all our offices and public areas. They were also given the mandate to report all the cases of infection and the infections in the office, and also with the families because of the following up after the Minister of Health put those protocols. All the areas were fumigated in the offices together with the Minister of Public Health. Once a week, we did the fumigation, and that prevented most of our staff from getting sick. Actually, the whole pandemic, up to now, and most of the infections occurred now due to the Delta virus, where we got 3 who were infected, and 1 was put on ICU, but he has recovered. Fortunately, we didn't have any deaths, but the ones who never went to hospital who were on isolation at home, there were about 20. So it was a very sad moment for staff, because it was creating a panic mode. When you hear that your colleague and you were working with them last week, they are now sick, that was a big challenge, and you had to bring even the motivational speakers to talk to our staff to make sure that for them to understand that if they protect themselves properly, they follow the Ministry of Health protocols, they were not likely to get the COVID-19. So we also organized for mass vaccination for all our staff. We arranged with the Minister of Health. They came to our premises and gave them the first vaccination, and they came for the second jab. During that time, we also organized for our customers who are walking in. At that period, they were also vaccinated, and we also donated our vehicles to the Ministry of Health to move within our area of jurisdiction, giving vaccines to the members of the public who are mostly our customers. Communication was key to all members of staff, and we opened a wall where we were reporting a WhatsApp group, where if you are not feeling well, you reported, and then there was a follow-up from this committee. And we are also communicating to the members of the public, especially the ones we were mingling with during our line of duty. So it has not been easy, but as we say, water is the first PPE. We have been monitoring our hand washing areas, even in our rural offices, because in the rural areas, the customers, because of the internet issues, most of them are not educated. They can't follow on social media. They have to walk into the offices. So we have also put protocols, and also kept drone even where somebody cannot sit. We have marked the sitting areas, and that also helped to prevent cross-contamination with the members of staff. It has not been easy, but thankfully we are now almost the Delta strain is almost conquered. We are at 3% countrywide, but we are not letting guard down on preventive measures, because as we see, treatment is very expensive, especially here in Kenya, because of the oxygen and those other issues that are required. So we are moving on, and we are hopeful that if we continue with, especially with the vaccination, and continue keeping the Ministry of Health protocols, they are taking care of our staff. Of course, we got a lot of support from the Ministry of Water, which gave us water treatment chemicals, And also from the development partners, especially the World Bank, we got conditional grant to mitigate the liquidity of the companies, because at that time, especially from March to September last year, we were not disconnecting, so we were given some finances to caution us on that. And also we got some more boreholes, some more water extensions through that period, last mile connectivities, which our staff were working on. And we are happy that even the PPEs they were provided with, they kept them safe. So that is how we have managed, Peter. And I'm happy that so far, so good. Thank you.
Thank you very much, Margaret, for the detail of your response there. First of all, see, does anyone have any questions or comments for Margaret? Anyone from the panelists? Okay, in the interest of time, we may have time later on for questions and answers, but let me move it on to Marieka. Marieka, are you ready to present on my question? And are you going to share that with Engineer Fontes? Yes, okay. So Marieka is the, she's the Regional Director of World WaterNet, and she's going to co-present with Engineer Ephantus Mugo. He's with the Nairobi City of Water and Sewerage, very close to where Margaret is right now, who just gave a presentation. Marieka, my question for you is, how have you intended to monitor COVID-19 in terms of traces in the sewerage system of Nairobi? Can you explain how you did that and what sort of benefits you could expect from that?
Yeah, thank you very much, and hi to you all. And listening to Margaret Maina and what happened in and around Nairobi, we are very pleased to present a pilot project that we have been starting since the outbreak of the pandemic. World WaterNet, Amsterdam-based, is in a water operators partnership under the Dutch Waterworks program with Nairobi Water since 2017. And in March, when the pandemic started, we were approached by the Dutch bank for the entrepreneurial bank, development bank, if we could support Nairobi Water in emergency response measures. And at that time, we were in the Netherlands upscaling our research on COVID surveillance in the sewerage as an additional way of surveillance of the spread of the coronavirus. So together with Nairobi Water and other Kenyan partners, being Nairobi Metropolitan Services, but also the International Livestock Research Institute, which is based in Nairobi, and the Dutch Water Research Institute, KWR, we have been setting up a pilot. And this week we are in the 12th week of full-scale sampling of the sewage of Nairobi for particles of the coronavirus, which are, by the way, very important to tell, non-active anymore, so no harm for the health, but they give a very good indication of the spread of the virus. And although the pilot is still ongoing, there's a huge potential for additional early warning. And also this surveillance can identify the virus spread amongst inhabitants who do not have symptoms. So nowadays in the Netherlands, twice a week, samples are taken from all 300 wastewater treatment plants, and they're used for the health policy makers to localize outbreaks and track the virus. But how this is working in Nairobi, there's Engineer Mugo who can tell you all much better than myself. So please, Engineer Mugo, go ahead.
Engineer Mugo, you can unmute yourself. There you go.
Thank you, Mariek, and good afternoon, good morning, all. We in Nairobi Water, we serve a population of 4.6 according to the last census that were done 2 years ago. During the day, and at night we serve during the day we serve a population of 6 million, and at night we serve a population of around 6 million because of those who come from the neighborhood. And when the first case of COVID-19 was reported in Kenya last year in March, and precisely 12th March last year, the entire country went into a panic mood, and things have never been the same up to now. Because at the national level, the country has so far registered 252,000 positive cases, and out of that, 101,000 are actually cases in Nairobi, and that contribute to 40% of the entire positivity in the country, only within one city of Nairobi. And this is actually now what informed the pilot project that Marieke just talked about. Because when this pandemic came, our services were affected because customers were denying our staff access to their properties. Other customers were not able to actually service their bills because their purchasing power was reduced due to loss of jobs and even customers. And we were also told by the government to provide free services to all informal settlement customers, because washing using water was one of the protocols of mitigating spread against the COVID-19. And due to this, when the proposal now came from our peer partners, World WaterNet, we actually embraced it very quickly, we as Nairobi Water and other key stakeholders, and we had to move on with it without any hesitation. What we did is that in addition to the company protocols of mitigating against spread of COVID-19, where our staff always use masks, sanitize using the sanitizers, and also observing the social distancing, we had now to go another extra mile to the level of the county, where now we were to do the COVID surveillance through the sewage. And as has been mentioned, this proposal seems to have been done elsewhere, and specifically in Netherlands, where Marieke comes from. It's a very effective tool in providing early warning signals of COVID, and also tracking the impact of medical and social interventions that are given by the government. And because of that, we identified the key stakeholders of the project. This included NMS, Nairobi Metropolitan Services, IRRI, that is International Livestock Research Institute, World WaterNet are also key partners, Water Research Institute from Netherlands, and Dutch Development Bank, who are actually main financiers of the project. And for us now to realize the project, it has to be done through sampling. We identified 11 sampling sites that are spread all over Nairobi, and the 11 sampling sites cover the informal settlements, the low-income areas, middle-income areas, and upmarket, because they all have different characteristics and even behavioral characteristics. We also have sampling sites at our two main treatment plants. One of them is Kariobangi treatment plant, and majorly Kariobangi treatment plant is the one that treats all the sewer that actually originate from CBD, that's in the city of Nairobi, CBD. Then we have another sampling site at the overall treatment plant, which is called the Dadera treatment plant. This is now where all the sewers of Nairobi actually are directed to. These are sewer pods. The one at Kariobangi is a mechanical treatment plant. Now, what guided the identification of the treatment of the sampling sites was one, the allocation and accessibility. And we had to ensure that the catchment areas, the catchment area here, I mean the area where the sewer that passes through a particular sampling point originates from, that those catchment areas do not overlap. Two, we also ensured that those areas represented the different population of the city. And also we went ahead and all those catchment areas that produce the sewer that passes through the respective sites are plotted on a GIS map, so that when the results are out, we are able to actually now work backwards and relate the respective results to a population from a particular area. And these sampling sites, if I may explain further, hello?
We can still hear you.
Oh, okay, fine. These sampling sites, once the samples are collected from them, they are delivered direct to IRRI for lab analysis. And the collection of the samples is basically done by Nairobi Water. The first sample was collected on 21st July, and that is where our 12 weeks started ticking from, which is ending by end of this week. It is now the 12th week. So far, we have collected 139 samples that are being analyzed at IRRI. If I may also explain how the sampling procedure is done, because it is not just sample and sample, it's normally a process whereby we use containers. Containers are used, and sewer that is flowing through the system is picked, and this is done after every 15 minutes from 8 to 11. That is our period of 3 hours, and every grab sample, 60 ml, is put on a container of 1.5 liters, and this now forms a composite sample. Now, this composite sample that is collected now over the period of 3 hours for the 11 sites are taken to IRRI and for analysis. And when they are picked, they are well kept in a cool box so that the composition does not degenerate. All this work, when we started as a team, we came up with an interim budget, and the budget is the interim budget is 200,000 euros. That translates to, at the current exchange rate, it translates to 26 million Kenya shillings. The Dutch Development Bank, or FMO, is meeting 50% of this budget as a grant. And then the balance of the 50% is being met through in-kind contribution by all the other stakeholders or other partners that I mentioned before. And when all this is done, it is going to assist a lot, because at the end of the day, the moment the pilot is now come to an end, I know it is going to be a project that is going to be for the whole of Kenya. And this is why I would say what next for the pilot project. I can actually say convincingly that once Nairobi is fixed through this pilot project, which is now going to mature to a full-fledged project, the rest of the country Kenya, will just be a walkover. Thank you.
Thank you very much, Engineer Mugo. Real quick, we're a little bit over time, but does anybody have any comments for Marieka or Engineer Mugo? All right, thank you both for that presentation. We're going to go into the second panel, but Susan, I want to offer you the mic to see if there are any words you'd like to share with the group and the audience.
Sure. I wanted to talk a little bit about a book that we published last year around this time, which I think underscores a lot of what we heard in the first part of the panel and provides a bridge to the second part as well. So how much time would you like me to take?
How does 4 to 5 minutes sound to you?
Sure, that sounds good. I'll do my best to not take much more time than that. And so I'm going to put in the chat a link to a book that we published in October of last year. And the title of this book is called Public Water and COVID-19, Dark Clouds and Silver Linings. And it includes case studies from, well, different countries in the world. In fact, there's 25 chapters, and it's all free, available for download by anyone in the world. And it is published by myself and two colleagues from the Municipal Services Project. So I wanted to thank you very much for the opportunity to talk about this book. So what we wanted to do in this book, and it's a rapid fire snapshot of what was happening in the height of the first wave of the pandemic, which we've already heard about from our public operators who are here with us on the call. All the data was collected and written in the first months of the pandemic, that is between March and August of 2020. And so as the pandemic rages on, the challenges that we describe in this book actually maybe become much more difficult. We had three goals, which was to provide a cross-section of insights on how public operators around the world are responding to the COVID crisis. We include case studies from Burkina Faso, Canada, Colombia, Finland, France, Germany, Ghana, Indonesia, Jamaica, Nigeria, Spain, South Africa, United States, Uruguay, and Venezuela. We also aim to identify best practices. We've heard about some of those earlier this afternoon for most of you, such as payment deferrals, careful targeting of subsidies, moratoria on cutoffs, and rapid reconnection. Of course, these measures were particularly important in the first wave of the pandemic, before it became clear that the pandemic is transmitted mainly through virus. Of course, the World Health Organization made that announcement only earlier this year. So we didn't know in the first wave of the pandemic, and water is key to public health. And then third, we wanted to highlight the needs and opportunities for a progressive future for public water. And what we argue is that the pandemic is both a threat and an opportunity for improved public water. And we've heard from the panelists this morning about different ways that public operators have collaborated together, shared information, pressured government officials, and that proximity of a public operator, I do think, facilitates those things. But there's also a dark cloud, and those have been mentioned, and we'll talk more about it in the panel that's coming. And that is that the financial impact of this crisis has been huge on public operators. You are not alone, for those of you who are on this panel from different operators, especially in the global south, where the restrictions and the constraints on budgets are much more extreme than they are in a place like Canada, where I am based. So, of course, there's been a loss of revenue. Lower demand for water, particularly from industry, has been a huge hit. Combined with a decrease in payments due to poverty, job loss, drastic falls in income. Also, the necessity of subsidizing consumption and reconnecting users. We heard about the moratoria on cutoffs in the cases this morning. But also the second factor that have also been mentioned are the increased costs, such as PPE, personal protective equipment, new work arrangements, new IT, digitization, emergency service provision, overtime for personnel, and also we heard of a number of different utilities who were dealing with health crises of their own. So in June 2020, the International Benchmarking Network suggested that collection rates had already fallen by 40% in the utilities that they monitor. It's been very extreme in different places in the world, and we provide some data about those kinds of trends. But I do want to just make a last plug, and that is about the silver lining of the crisis. So we call the book, again, Dark Clouds and Silver Linings. And in the book, which again, I encourage you to have a look at, it's not our intent to prove that public water operators are better than private operators. We didn't conduct comparable research, but what the different case studies highlight here is that there are good reasons to believe that public water operators can do things differently. And we've heard about some of those already, and we're going to hear more. First is the better potential for collaboration with other public service providers, given the broad public good mandates that public water operators have. And also, I think that the different case studies that we talk about in the book emphasize that public operators have longer term time horizons with regards to investments in people, infrastructure, and systems where they work. And I think that's been emphasized as well. So I will conclude with talking about financing just briefly as a bridge to our next panel. So the new project that we are working on is on the role of public banks. And what we want to suggest is that public banks do provide an untapped resource that doesn't get enough attention. It doesn't get enough attention, particularly from academics like me. When you go to do research on water, you find that a lot of what's published is on private operators, and we know very little about public operators. It's also true about banks. So our new project looks at these public banks and the relationships that they are building or not building with different public water operators in the world. So there's more than 900 public banks around the world. They account for 17% of global banking resources. And some of these banks, such as the Dutch Netherlands Waterstaat Bank, and excuse me, I don't speak Dutch, or the NWB, and also the German KfW, which I know some of you might have experiences with. These institutions have been lending to public water operators at very low rates, providing expert public sector advice for decades. There's also new ones. And what we suggest in this book and in a companion volume that I will also put a link to in the chat is that we need to know a lot more about these public banks, and especially in the context of a public health crisis that has highlighted the need for coordination amongst public sector actors in order to come up with a coherent response to this crisis. And so that's why in the time I was asked for 20 words to describe what I wanted to leave people with. And what I suggest in those 20 words is that public operators are committed to long-term time horizons, making investments in people, infrastructure, and systems where they work. So again, thank you very much. And I really look forward to the next panel.
Susan, thank you very much. And particularly for sharing those two books and all the hard work you put into that and the research and making those available for free. I'm sure that they will be used. Let me just mention the two books again. And the first is Public Water and COVID-19, Dark Clouds and Silver Linings. And the other one is Public Banks and COVID-19, Combating the Pandemic with Public Finance. Susan, again, thank you very much. All right. Lars, unless you have any objections, I'm going to move right into the second panel. And with Engineer Kasenga Hara. Engineer Hara, are you there? And can you turn on your, there you go, very good. So let me introduce my friend Kasenga Hara. He's the Executive Secretary for the Eastern and Southern Africa Water and Sanitation ESOWAS Regulators Association. And Engineer Kasenga, the question that I have for you, and this is all about financial sustainability, is how did regulators in Africa, from your knowledge, how did they adapt their requirements for the utilities during the pandemic? Can you provide any helpful examples that others could follow in terms of how they were able to adapt? Sometimes it's not easy to adapt quickly, but because of the pandemic, there was that need. Can you share any examples from Africa?
Thank you very much, Peter, and good afternoon, good morning to everybody joining us on this discussion. So yes, indeed, unprecedented moments during the COVID. We began to get cases in our region, which is the Eastern and Southern African region, right about the latter stages of the first quarter. And immediately we got dragged into this issue. Two reasons. One, the COVID-19 is essentially an health issue, but also that the water sector was identified as a key sector in combating it, as we heard also from my colleagues. So the interministerial groups that led the initiative to fight the COVID also brought us on board. But there were measures that these sort of groups kind of imposed on us, and we were obliged to following them, some of which have been mentioned. Things like the non-disconnection of defaulting customers and essentially relaxing payments for water and sanitation services. You heard from the example of Kenya, there were also free services demanded, especially for those vulnerable groups, but also reconnections. And I know that Mozambique reconnected over 25,000 customers that were previously disconnected, and these were essentially defaulting customers. So some of these measures really had unintended consequences on the financial health of the utilities. You can imagine, I think Malawi did mention revenues going down, revenue collection also going down by as much as 50%. In our case, from our study, we noted that the revenues dropped by about 10 to 12% for reasons also that Susan did touch on, because businesses essentially shut. They are the largest consumers, and they are also fairly on a higher tariff tier. The domestic customers, of course, did consume quite a lot, but these were also the ones that our focus was on ensuring that they had a continuity of services and not paying. So these were some of the intended consequences, and we had to adapt to that situation to help governments, the general public at large, fight the COVID. But what are some of the things that the regulators did in 10? Because the biggest impact then went on the utilities that were supplying a service. And to cushion the utilities in terms of liquidity, regulators relaxed some of the regulatory mechanisms. I'll give an example. It's a requirement in Zambia that utilities that have crossed over 100% cost coverage in terms of operation and maintenance ring-fence certain funds for improvement, say, of sanitation. So there's that ring-fencing aspect. But because they were impacted, you heard they couldn't procure chemicals in time, they couldn't procure other accessories in time, regulators freed these resources instead of holding them up in a bank account, freeing them for the utilities to utilize and help improve the situation. The regulators also that are required to collect a license fee from the utilities did relax this, so essentially delayed payments from the utilities so that they could operate, become a going concern. The other measures the regulators undertook to help the situation was to extensively lobby the government. So an example is Zambia, where traditionally the government institutions take their time to pay for water bills, and other countries as well, Kenya, Mozambique, Malawi. But the regulators lobbied the governments to ensure that at least the government institutions paid their water bills on time, paid also the debts that they owed to these utilities to help with the liquidity challenges. And also the regulators played a key role in mobilizing resources in the form of grants and other inputs in the form of chemicals from cooperating partners. The partners like UNICEF or GIZ that have been traditional partners to the water sector. So that center stage that the regulators played, I think, cannot be overemphasized. Now, going forward, the regulators right across our region are looking at utilities putting in place broader emergency response plans so that we respond quite adequately to shocks that we may encounter in the future. The response plans that existed prior to the COVID, and this was very unexpected, focus much more on pollution control, contamination, but then we were hit with this unprecedented thing that even affected the way business operates generally and economies operate. So we're helping the utilities come up with robust methods, and these require interagency collaboration or multi-stakeholder collaboration in terms of the way they are implemented. So we bring on board agencies like the water resources people, the environmental resources people, the local authorities who are essentially there for planning purposes to try and bring sanity to the way that the sector is managed. I think that one of the biggest things that ever came out of the whole COVID-19, regardless of it having been a huge challenge, is also that for the very first time, we could see politicians from the Ministry of Health, from finance, and other sectors as well, sitting together and steering decision-making processes. And as a sector, we need to ride on some of these niches that we saw as very, very strong initiatives that could help us going forward with planning and decision-making. So I think these are key things that I could cite in terms of adaptation. Remember, one thing is the freeing up of resources in the form of ring-fence finances, and also the waiver on license fees. It doesn't mean that there are free services to be provided. Obviously, when utilities recover some of these finances, we have to be paid back. I end here, Peter. Thank you.
Engineer Kasanga, thank you very much for that. Engineer Kasanga, were there any studies that were published with regards to the actions taken by regulators in different countries that you're aware of during the pandemic?
Yes, the SOAS Regulators Association led an initiative in the region, gathered information, and then wrote a paper on how impacted the sector was. We also did work with WASHFIN to look into the financial health of utilities and what we could do going forward. We worked with other partners as well. I already mentioned UNICEF, looking into the broader response and recovery mechanism. So yes, there's some papers that we could share arising from all this situation.
Okay, and the WASHFIN one that you're talking about is the project that was supported by the U.S. Agency for International Development, USAID. Okay.
Exactly, and that was looking at the financial health, but also improving the financial position of utilities going forward.
Okay, Engineer Kasanga, thank you very much for that presentation. All right, let's move from Zambia all the way over to Malawi. And Gladwell, are you there? Can you open up your camera? Let's see. So Gladwell Mpande is the Director of Finance with the Lilongwe Water Board. And Gladwell, can you open up your camera? Valentine, do you know if, are you, there we go. Gladwell, also you need to unmute yourself. Okay, Valentine, you don't know if Gladwell is near you, do you?
Okay. No, but let me just give him a call. Just one moment.
Thanks. All right. While we're doing that, Gladwell, there we go. Gladwell, how are you? Okay, you're on mute. You can
fine, thank you. How are you?
Very good, Gladwell. Thank you.
Thanks,
Everything looks good. All right. I appreciate being able to see you right now. All right,
thank
Gladwell,
you.
on behalf of the Lilongwe Water Board, the question I have for you is, how did the Lilongwe Water Board analyze the long-term financial impacts from the pandemic? And if so, how does it plan to mitigate those long-term financial impacts? The floor is yours.
Yeah, thank you very much. Indeed, the pandemic has not spared any other sector or country. We have equally been affected by the pandemic. You know, most of our customers, they have their incomes been affected because of the pandemic, and as such, that has also resulted in them being unable to service their. So indeed, the pandemic has actually resulted in our not being able to meet some of the obligations that we have with the our partners, like the financing agreements that we have with our lenders and also other related service providers. So we've done, maybe before I go to what we have done, let me also mention that you know, COVID is a pandemic that relies or requires sanitation in terms of water, hand washing, and the like. So we were kind of constrained, not because it was part of the sanitation issue that we could not disconnect them, whilst at the same time they would want to promote hygiene, frequent hand washing, and so on. So we are kind of constrained in that regard. And so what we are doing is to, of course, continually engage the to be settling their bills with some flexible repayment plans. And also for most of the government institutions which owed us some money, we had engaged government that ended up in settling the bills on behalf of those government institutions. So that kind of gave us some cushion, some cash flows that carefully to ensure that we are still liquid, even in terms of hard times as we are going through. So the other issue is we had to scale down the level of our capex, the capital budget, because I think we are likely not to get the cash flows that we needed, because most of the businesses are affected, not only individuals, but including businesses. So because of that, we have scaled down our capex activities just as to match with the cash flows that we have with the level of capex that we are going to undertake.
Gladwell, are you able to turn your camera back on?
Okay. Okay, so I was saying,
thank you.
I hope I was still audible enough at the time when I had taken off my. Yeah, so I was saying we had reduced the level of our capex just to ensure that it matches with the kind of resources that we are currently generating, so that we do not live beyond our means. As a long-term one, I think COVID it appears it's going to be here for some time, and therefore we are sensitizing the communities and our customers to ensure that at least they still need to include their within their budget payment for utilities, because if they do not, at some point we will end up forcing them to pay through a disconnection. So maybe that's what I would say for now for what we are doing. Thank you very much.
Okay, Gladwell, thank you very much for that presentation in this second panel discussion. All right, let me jump directly to Cosmas Makala. He's with Lusaka Water and Sewerage, and he's the Director of Finance. And there you go. Cosmas, it looks like you've got a good connection. You can unmute yourself. And the question I have for you, Cosmas, is how has Lusaka Water Supply and Sewerage analyzed the long-term financial impacts of the pandemic? Anything different from the Lilongwe Water Board? You have more customers. Jonathan Campata talked about the impact that the pandemic had on you. How have you managed what the long-term impacts are going to be on your finances?
Thank you very much. Good afternoon, good morning to all the participants. Yes, Lusaka Water Supply and Sanitation Company did carry out a financial impact assessment of COVID-19 using the financial planning tool that was developed by the World Bank Global Water Practice Group to assist the water service providers in emerging countries to assess the impact of COVID-19 so that they could make evidence-based justification for funding requests. The key inputs into the financial tool that we used to assess the impact of COVID-19. One, it was the emergency response plan that we developed as a company in March following the outbreak of COVID-19 in Zambia. The emergency response plan was aimed at ensuring that employees were protected from contracting COVID-19 through the provision of PPE as indicated by other participants. Also, we had to invest in technology to support remote working where it was possible. Where it wasn't possible because of field work, we had to provide PPP to our employees, and also had to reduce the teams that were working together so that we could reduce contact. We also had to attend to issues of supply chain. We made a provision for acquisition of materials that were critical to the provision of our services, such as chemicals, pipes and fittings, chlorinators. We also had to make a provision for some expansion in terms of the communal facilities where our customers in the peri-urban areas use kiosks. We had to construct some more facilities to ensure that we reduced crowding at any one point. We also had to upscaling our investments in customer relationship management systems that emphasized on digital payment and communication systems with our customers, since we knew that we needed to reduce physical contact. The other input into the model were the financial information that past data that we had, and also had to make some assumptions regarding the impact of COVID-19. We anticipated that as a result of COVID-19, some of our customers who were directly impacted by COVID-19, like in the breweries and the hospitality industry, where the restaurants and bars were closed, consumption was going to reduce. So we expected that revenue from the brewery and the beverage sector would go down. We also anticipated, as a result of the ban on disconnection, as indicated by the previous speakers, would result in a reduction in our revenue collections, because our domestic customers mostly respond to requests to pay when they are disconnected. So we anticipated a reduction. As I indicated, we also anticipated increase in our operating and capital expenditure. Now, coming to the model itself, we prepared two forecasts. One was a baseline cash flow forecast that assumed normal operations. The second one was the COVID-19 cash flows that took into account the increase in operating costs and also reduction in our collections. The model did indicate that our cash flow deficit was going to increase to $18.3 million. We were already in a deficit before COVID-19 hit us. we had a cash flow deficit of about 9.8. So the impact of COVID-19 was that our cash flow deficit was going to increase by about 87%. The reason why we already had the cash flow deficit was because of the a significant increase in our electricity costs. At the beginning of the year 2020, our electricity service provider increased tariffs for electricity, and that resulted in our costs covered by revenue reducing from about 112% to about 80%. So we already had it.
In any way, any of the samples that we have sent to the lab isolated any embryo. Dr. Besa.
We seem to have someone talking as well. Yes, we also had a challenge regarding the tariff. The tariff was not able to sustain our operations after the increase in electricity costs. Throughout 2020, we never had a tariff increase. We also had a challenge regarding collection of accounts receivables, mostly from government and domestic customers, which resulted into a very huge deficit. Of course, we also have a challenge regarding our costs, staff costs. Our staff costs are around 46% of our revenue. Now, when COVID-19 impacted on our top line, that's our revenue, we were not able to service some of the payables that we had, as the focus was more on the interventions and also staff related. In terms of the interventions that we took, on the government debt, we engaged the government and agreed to execute a debt swap where the government settled the debts that they had with us, and also settled the electricity bills using the receivables from government. So government paid the electricity service provider directly, and also we had a debt swap with government regarding the taxes. So that helped us to get some relief in terms of paying our electricity bills. In terms of the domestic customers, we invested in digital payment systems where customers were able to pay through bank transfers and also through mobile money accounts, as a number of our customers have mobile money accounts. We also communicated with our customers by sending them digital messages reminding them to pay their water bills. In the long term, we intend to install prepaid meters so that even if there is a ban on disconnection, will not be affected by such a ban. We are looking at sourcing funds to install prepaid meters. We also have some loans, concessional loans with government. Some of them were already due at the time of COVID-19, and some of them are due this year. So we negotiated with government to restructure the $105 million US dollar loan that we have with government. Basically, the restructuring of the loan involved extending the grace period by another 5 years, During the grace period, we won't be able to pay interest, and then the principal will be paid much later. We also negotiated with government to reduce the interest rate from about 5% to 0.25%. We also negotiated to convert the US dollar denominated loans into local currency so that the loan does not grow as a result of exchange losses. So that will ensure that we're able to plan and factor in the loans in our tariff application. We also, as indicated by the previous speakers, did access some grants from government and other donors like UNICEF and GIZ for chemicals and other materials. In the long term also, we are implementing a project, the Kafio Bulk project, which will be commissioned this year. That will help us attain financial sustainability. That is the only project that we prioritize in terms of capital expenditure. Other capital expenditure requirements were suspended as a result of the impact of COVID-19, but we prioritized financing the Kafio Bulk because it will give us additional water and revenue. Thank you very much. That is my presentation regarding our COVID-19 experience. Thank you very much.
Cosmos, thank you very much for that presentation. And actually, all the panelists on the second panel and even the panelists on the first panel, I appreciate everyone spending the time to think about the presentation and giving it, particularly for the audience and all those who may be listening to a recording of this later on. Let me bring in Saravanan. Saravanan, are you there? Can you open up your, there you go. Would you like to offer any closing remarks for the session, for the two panel sessions?
Thanks, Peter. Yes. How much time do we have?
I think you have about 10 minutes.
Oh, great. Thanks. Thank you, Peter, for moderating this session and, very comprehensively putting the questions to the panelists. And the panelists have been able to, take on each and every sector that has been core during the COVID times. One is the supply chain. In fact, supply chain disruptions that has occurred in many cities around the world, and the panelists have been able to highlight some of these and the measures they have undertaken to overcome it. And there is something very significant that comes out from most of the panelists is the flexibility in the regulators. That has been one of the significant. And more going for local products rather than the international products like chemicals or machineries or something. But at the same time, in order to ensure some of the machineries, there has been a good collaboration between the government with the international, with the other countries through the Ministry of Finances, Foreign Affairs, and the embassies. And what we see is a nice collaboration between the different countries, or South-South or North-South collaboration that has taken place either in terms of funding or in ensuring the shipment is being supplied to the local countries that is required to meet the water supply requirements. And this strategic collaboration is something very significantly highlighted by all the panelists. But there is another thing, the staff concerns and the workforce. Disruption is also something that has been highlighted by the panelists. And what is interesting is, again, they have been able to, the low water operators have been able to contextualize these problems and try to find the local solutions. And this could be working in different forms of shifts and at the same time trying to maintain the health protocols and also ensure the people are getting water supply without any disruptions. And this is something very significantly coming out from most of the panelists. And what is the other interesting point from the panelists is that using the water network lines in order to offer early warning measures using the COVID and by tracking the COVID virus, and trying to involve various stakeholders to bring about a preventive measure. And that is something very significantly addressed by the panelists and can also serve as an example or a model for other cities to take on not only COVID as a case, but there are other chemicals and other pathogens that can be tracked in order to take a very preventive measure. So I think this is something very importantly highlighted by the panelists. And while these are all more contextualized and more specific to the water operators and so on, the other panelists highlighted how the regulatory authorities have helped in making everything flexible in terms of uh, relaxing the rules to suit the local condition, in freeing the utilities from many of the financial debts, in offering some licensing fee relaxation in the licensing fees, and extensively lobbying with the government in payment of the water bills, at least from the government and from the domestic functioning. And in terms of bringing a multi-stakeholder involvement in steering the process of decision making. I think this is something very significant, especially in the Southern African context, and this can serve as a very good example how water utilities and water operators can take up a solution during a pandemic time, not only just pandemic time, but also any disaster-related events, to take up certain measures. And this offers something very significant. But certainly we should highlight the role of digitalization in the water operators, which has been something really good in helping gaining access to the customers. That is one. In enhancing the digital payment from the users. So this is another thing that has been used, and in enhancing the monitoring system. And I think with these sort of mechanisms, the water operators or the water utilities have shown the capacity to be adaptive and being very flexible to meet the local requirement, at the same time ensuring the health is also on the top priority for these water utilities. And I think with this, I would, and it is also to need to highlight the role of international agencies in offering loans for these water utilities, and also the federal government or respective national governments in offering flexibility for the water utilities in payment of bills or in restructuring loans. So these are some of the points that the panelists highlighted, which primarily shows the water operators' ability to be adaptive, at the same time try to ensure that the services are uninterrupted for the local people. Thank you very much, Peter.
Sarvanan, thank you very much for that wrap up. And I apologize, I didn't introduce your affiliation. Maybe you can just very briefly say who you're with and the position you hold for the record.
Okay, yeah, it's not a problem, Peter. I am Dr. Saravanan. I am with the German Development Institute in Bonn, but I also represent the Bonn Water Network. It's a consortium of about 10 institutions based in Bonn, which primarily works on a diverse areas of water management, ranging from hydrological water management issues to water governance, to urban water and sanitation, to rural water supply and sanitation too. And it is a pleasure to collaborate with Peter Messi at Rockville Foundation in organizing this session. And I'm also grateful to GoOPA for giving us this opportunity. And thank you so much, Peter.
Thank you. Okay, we have a little bit of time left. If there's anyone who's got any comments or questions for any of the other panelists, or if there's any questions from the audience. Susan, go ahead. If you can turn off your mute button and turn on the camera.
Great, thank you. I had a question actually for the partnership that was discussed earlier this morning. I wanted to know about the experience with having to move online, if they had any comments about whether that's been helpful or has it hindered. And I ask that because I'm a teacher, and as you probably imagine, I'm doing a lot online, and I'd like to know about your experience. Thanks.
Susan, do you want to direct that towards
Yeah,
anyone or any utility in particular?
it's actually to the partnership, which is Marika and Francis were in the last speakers in the first panel, but anyone else who has experience with moving online and partnership, especially public partnerships that are being described, would be more than welcome.
Okay, thanks, Susan. Mariaka, do you want to respond?
Yeah, thank you for the question. And the pilot project that we presented indeed started fully online, and it worked very well. But I guess the main reason is that we already knew each other since 2017. And then I also have to say that now we are able to meet again since this summer. We had 2 working visits also to the laboratory doing the testing, that it made the work so much more effective. So we were able to set this up online and had good meetings, but we missed something, I have to say. But maybe Engineer Mugo, if you're still there, please add.
Engineer Mugo, if you could, yeah.
Yes, it's true. Particularly when it comes to management of projects, online interactions is not able to actually achieve everything as much as we have to adopt it because of the new requirements of the protocols. Maybe as we go along and as we continue now engaging and working more or less online, it might end up being a kind of an acceptable norm. But I would say that all is well with the new technology of working online, but with project management, it is not wholesome. But let me add also that the onset of the pandemic also in some areas brought good things, because we as Nairobi Water, we had just a few months earlier, before the onset of the pandemic in March, we had launched online contracting just a few months prior to the pandemic. And customers were not comfortable, and majority of them were not willing to actually contract online. But as soon as the pandemic came and protocols were given by the government to mitigate against now the spread of COVID, we got a big surge in customers contracting online. And I would say that we had gone online so as to improve our performances towards the service delivery. And if I could compare the average time for contracting a customer from the time of application to the time the customer get an account and consume water, on average it was going to overall around 41 days. And as soon as we accepted now that technology was part of life, the 41 days actually reduced to 8 days from time of application to the time of connection and getting our service. So the pandemic, though it came, and it has been a little challenge, it also brought another good angle towards our business. Thank you.
Thank you, Engineer Muko. Any other questions from the panelists? We've got such a diverse and talented group of panelists. You must have questions for each other. Give somebody a hard question.
Peter, perhaps can I also just say something about this virtual working space that the COVID has taught us to innovate, really. And you heard also from Cosmos that we're now encouraging a lot of e-payments to kind of limit that interaction between the customer and the utility staff, but also the handling of paper. So a lot of things are now being done virtually, including the promotion of smart meters. In the comfort of your office, you're able to either connect or disconnect a customer. But also from the regulator side, we're using more and more of the IT stuff. We designed a platform electronic, which we call My Watts and Quick Fix, and we're rolling this out to more and more of the utilities. It's a three-way interface between the utility, the regulator, and the customer. So the customers are able to lodge in complaints, check their bills, and the regulator is also able to monitor the utilities in terms of the way they're responding to those customer complaints. So I think we're getting used to this sort of situation, previously very frustrating. But I wanted to ask a question also to my colleagues from Nairobi, the wastewater monitoring vis-a-vis the COVID. What exactly are you looking for in the wastewater? And you say this makes monitoring of traceability quite easy, but the wastewater is coming from so many areas into a wastewater plant. At which points are you monitoring? And what exactly are you looking for? And does that give a clear indication of how the COVID is spreading? I'm not sure about this topic, or whether we're also finding traces of the COVID ending up in potable water resources.
Yeah, Engineer Mugo, should I give it a start and then maybe you add?
Yeah, it's okay. It's okay.
Yeah, so we are looking for trends indeed. It's a very good question because indeed we are sampling at the wastewater treatment plants and at 11 more upstream points. So it's the collected wastewater, and again, it are coronavirus particles. They are non-active, but they give an indication if there's a sudden increase in cases. And then policymakers would know where to intervene and where to do more individual testing, for example. So in the first lockdown, we heard the cases where total areas were locked down. And with this monitoring in place, you can be more careful in such quite harsh measures. Again, yeah, just let me also say that for the pilot in Nairobi, we're at the moment, the sampling campaign is full speed, but the analysis is still going on. So we had to wait for reagents and consumables to arrive from abroad. So in the next month, we will do the full analysis and see which trends we can detect from the last 12 weeks of sampling. But for what we were able to detect in Europe was the upcome of the Delta variant, for example. And these kind of things you can see as a trend. It's early warning. It's often a couple of days earlier than the other surveillance, individual tests, people getting tested, what you see in the hospitals. So it's also for policymakers to act and to take the right measures. So it's a totally different kind of surveillance. This is happening for polio already, also in Nairobi, by the way, and it could happen for other pathogens. And it's much cheaper than all the individual testing. But again, it's an addition to individual testing. Engineer Mugo, please add.
Yes, thank you, Malik. Bwana Kasega, the way we are identifying the sampling sites, we identify a manhole sewer manhole. And one thing I would like to confirm here is that our sewer network is like a cobweb. Lateral lines from all directions, interconnections, and all that going to manholes coming from the trunk sewers. Now we identify a particular manhole, and always a manhole most of the time is either on-line or at the junction where many laterals meet. Then we make sure that the catchment area, where now the catchment area here means the source of that sewer that is passing a particular sampling site, we ensure that it does not overlap with another. And we delineate it clearly with clear boundaries, or where that sewer passing a particular sampling point is coming from, so that when the results that are found from that particular point are able to be related to a particular population, that we are able to be specific that these results are produced by a population that is within this particular area. So the delineation, the catchment areas do not overlap. So that is one of the consideration of identification of those sampling sites. Then we have also considered the main treatment plant, where all the sewers of this county gravitate to, is one of the sampling area. This now give an overall indication of the county where the results comes out. And we have mapped these sampling sites together with their attributes and the catchment areas on GIS map, such that when you point to a particular sampling site, you are able to also see where the sewers that are passing through that particular sampling points are coming from. So you are able to work backwards after getting the results to where the source is. Yes, I don't know whether that has answered you.
Thank you very much. I think you've quite adequately answered that. The last bit was, are we finding also traces into the potable water? Because in some cases, the same wastewater is the one that goes to the water bodies, and eventually there could be some utility downstream also abstracting the same water for treatment and distribution.
I would like to add something. I talked of us doing it over a period of 3 hours from 8 to 11. Earlier, the consideration was that we do it from slightly earlier to around 10. But there were logistic issues. Now, the choice of time was also guided, and the consideration was when people wake up in the morning, 5 in the morning, up to the time when they leave to go to their respective areas of work. That is the time when people now actually use the washrooms most, that hour of the early morning. And since it had to have some transit time to get to the network, we consider that the sample that are picked around those hours of the morning are very rich with now the human waste, other than kitchen water and even water from the washings. So that was now the consideration of the choice of time. Yes, thank you.
Thank you, Engineer Mugo. Any other comments or questions from the panelists?
Peter, I have, can I ask?
Yeah, please go ahead.
I think the water operators who are in this panel come from different Southern African nations, but also highlight a little bit on their cooperations among the nation, and which is very significant, but not necessarily restricted to the region, but also goes internationally, goes to the Europe and North-South cooperation and so on. So my question is, any one panelist can answer this. Do you think the triangular cooperation between North-South, South-South cooperation can enhance some of the challenges currently it has been faced by the international communities. And does COVID offer any lessons to strengthen such sort of a collaboration or cooperations? Thank you.
All right, so Saravanan, maybe I'll just punish somebody and pick on them to respond to your question. Let's see if Jonathan Kempada, are you still there? Because I know that the Lusaka Water and Sewerage, they do a lot of sharing with different utilities. I don't think Jonathan is there. Valentine, can I ask you, I know you've often commented about sharing with different utilities, lessons learned and so on, but Saravanan was going beyond just utilities in Africa, sort of north-south sharing and even beyond. Do you want to comment on that?
Hi, Peter. Thank you. Yes, at the moment, for us, Lilongora Board, our knowledge sharing is limited within the region.
As late as yesterday, is that line
And there is a
Hold on one second. Jonathan, can you put yourself on mute? Or the, yeah, thank you, Jonathan. Go ahead, Valentine.
All right, thank you. Yeah, I was saying of late, the focus has been on partnerships and knowledge sharing within the region, primarily because I think we share the similar structure, similar challenges, and we have similar solutions to some of the problems that we face. But we are looking forward to expanding these platforms and knowledge sharing activities with other utilities. Recently, we had a partnership with the Vitens Evidence from the Netherlands. We are also looking at partnering with other utilities in Japan, and just to share the knowledge and solutions to some of the challenges that we have. Of course, one of the issues from the early interactions we had with Vitens, for example, was that there is it's a huge leap for us where we are at the moment and to get to where our colleagues are, but it's still good to know what they're doing, and it creates a roadmap for us to follow and try to improve our operations. So yeah, we're looking forward to expanding our knowledge sharing activities with utilities across the borders, across Africa. Thank you.
And also, Valentine, I would just add the work you're doing with Rock Blue, you're able to share with about 6 other different utilities in Southern and Eastern Africa.
Absolutely, yes.
There's another question, I think, from Engineer Kasanga. Engineer Kasanga, go ahead. You can open up your camera and your mic.
Actually, not a question, but a response to the question that has been floated, and partly Valentine has answered. The VTENS program that links the North and the South, I think it's called the Waterworks program, and I know that there are a couple of utilities in the Southern African region that are on this kind of partnership, from Zambia, Kenya, I think Mozambique, and other countries. But also, just last week, we had a dialogue in South Africa between the EU and SADC, and we're looking at COVID and coming out more resilient on the COVID. So this was a good platform. We're looking at co-creation of knowledge, the knowledge transfer itself, North and South, and also technology. So things that I already alluded to, like smart meters and so on, being encouraged also on this part of the continent. I think those are commendable dialogues we need to continue to have.
Kasanga, thank you very much. We've got 2 more minutes. Jonathan Kempada, I saw your camera open up. Is there anything you wanted to add before we close?
Yes, Peter. Thank you. I think I just wanted to indicate that I think even by the theme of this this conference. It's important that we forge partnerships with other utility companies. I think we can learn a lot from each other. Particularly, I think the issues of innovation, using local resources to overcome our operational challenges. As I indicated, some of our inputs like chemicals and so on are imported, but I believe that we can learn from other utilities how they've gone around this aspect by having some local solutions, so that when we are faced with a calamity, I think COVID is not the first and last calamity we're going to face. We should be able to be more or less like self-sustaining in terms of our operations for the sustainable point of view. Thank you.
Okay, Jonathan, thank you very much for wrapping us up there. Thank you to all the panelists. Thank you as well to GWOPA for hosting this. And everyone have a wonderful rest of your day, rest of your week. Stay safe. Stay away from COVID. Bye, everybody.
Thank you very much. Good day. Bye.
Thank you.
Bye. Bye.
Bye.
Thank you.
What? Already over? No, we have plenty more options to continue the discussions and peer exchange beyond the Congress.
Tell me more. What are the options?
Well, GWOPA membership, for example. By becoming a member of GWOPA, everyone can connect to a global alliance of practitioners and experts. There are two ways of becoming a member. First, institutional members. Institutions can participate in GWOPA's assemblies and are eligible to run and vote in its international steering committee elections. Or second, individual members. Individuals can connect and engage with peers in the online GWOPA community. We have created a space that allows for networking and easy communication. Meet future WOP partners, stay up to date on project opportunities, and participate in peer-to-peer learning opportunities.
Sounds great. How can I join?
Simply go to www.gwopa.org and register for free. If you want to know more, you can follow GWOPA on social media and subscribe to the newsletter. Thanks for joining the 4th Global TOPS Congress. We'll see you soon.